talk about the heart rate. The heart rate is a baseline test used for individualizing, monitoring, and adjusting training programs. The heart rates that we usually test for is the heart rate max and the resting heart rate. The resting heart rate is usually taken at rest, and the normal resting heart rate is between 60 to 80 beats per minute. The resting heart rate is taken at the radial pulse using the index finger and the middle finger, pressing and palpating into the radial artery until a beat is felt. The heart rate is a coordination between time and count. The heart rate is usually taken using minutes, and the count should start at number 0 when the first beat is felt and start while the time is started. After a minute, the number recorded should be written down. The maximum heart rate is calculated subtracting 220 minus the 8, which is 220 minus age. So if somebody's 20 years old, their heart rate max would be 200. The heart rate zone, training zone, is usually found between the resting heart rate and the maximum heart rate.
Take you through the blood pressure test. The blood pressure test is a baseline test for cardiovascular risks. Well, you need two basic equipment: a sphygmomanometer and a stethoscope. But first, you're going to make sure you have the right size blood pressure cuff for the person you're testing. Blood pressure test should be taken while they're sitting, but not ideal for emergency risk in an emergency situation. First, you apply the blood pressure cuff onto the arm with the valves facing up. Then you attach the mercury reader and for the stethoscope. The stethoscope should be facing out because that's the direction your eardrums are facing. You check for a pulse. First, you inflate the sphygmomanometer up to 30 milliliter of mercury above the normal blood pressure reading of the test subject. So about to 180. Then you release the mercury a couple millimeters per second, 1 or 2 millimeters per second, until you hear the first sound. The first sound is called the systolic blood pressure. And then you keep going until you hear the second sound, which is called which you hear no sound, which is called diastolic. After no sound, you can completely release the sphygmometer until the air is completely deflated, and that's how you check the blood pressure. For the body composition is a skin fold test. On the female, there are 3 sites you should use. That is the tricep, the iliac, suprailiac, and the thigh. The tricep marking is a horizontal marking taken between the acromion process and the olecranon process. So you use a tape measure between halfway between the olecranon process and the acromion process, and you make a mark. The marking should be taken on a horizontal marking and release. The next site is the suprailiac, which is right above the iliac crest. It's a diagonal marking, and you hold it at a spot for a second, then release. The third marking is the thigh, which is midway between the crease of the hip and the top of the patella. So to take the marking in the thigh, you grab the skin, release the muscle, pinch, second, take the reading and release. The fourth test is the FMS active straight leg raise. FMS active straight leg raise is a part of the functional movement screen
which is a system of evaluations that tests for an athlete's movement patterns. The active straight leg raise is a test that tests the ability of the athlete to disassociate the lower extremities from the torso while using the hamstring and gastroc soleus flexibility while keeping the pelvis stabilized. The first part of the FMS active straight leg raise is that the athlete should be laying on his back. Then a tape measure should be used to measure halfway between the mid patella and the crease of the hip. At midpoint, a dial should be placed, and the athlete is then required to raise his leg perpendicular to the dial. If the athlete is unable to raise his leg without pain past the dial, then the athlete is then required to change position, and the dial should be placed mid-patella, where then the athlete is then required to raise his legs again. Past the medial malleus should be past the dial for the athlete to be able to score in the FMS. If the athlete is unable to score past the dial, then the athlete should be given a score of 1. If pain or compensations are used, then the athlete should be given a score of 0. The test that I'm going to be talking about is the YMCA step test, which requires 3 components: a metronome, a stopwatch, and a 12-inch box. The YMCA step test is a submaximal heart rate test, which is used to test heart rate recovery after exercise. The YMCA step test is a 3-minute step test, which requires there are gender-specific requirements. For females, it is 88 beats per minute, while for males, it is 96 beats per minute. The metronome is started in an up-up, down-down motion, while the client or athlete starts stepping at each beat in the metronome until the 3 minutes is done. A minute after the 3 minutes of stepping, the heart rate should be taken for the client. That's how you do the YMCA step test. The 6th test I'll be talking about is the push-up test. The push-up test is a test that tests for the athlete's upper body muscle strength endurance. The push-up test procedures are that the athlete will try to do as much push-ups as he can in 1 minute. The push-up test is standardized by using the modified push-ups and the normal push-ups. The modified push-up is used for people who are not able to do the standard push-up. The push-up is conducted with arms a little bit wider than shoulder width and with a yoga block at the chest. The push-up test is each push-up is counted when the chest touches the yoga block. The amount of push-ups done in a minute is recorded. The 7th test is the standing long jump. The standing long jump is an ideal test to test horizontal power of the lower extremities. The standing long jump is used in the NFL Combine to test how far an athlete could jump from a non-staggered position. The procedures for the standing long jump is that the athlete has his toes at the starting line, and is required to propel his body and plant his legs in as far distance as possible after planting his legs without moving. The distance is marked at the back of the heel of the last foot landed. 8th test is the 40-yard dash. The 40-yard dash should be done on a track or a field where distance can be measured. The 40-yard dash is the most common test of speed, which is used, and the 40-yard dash is used in NFL Combine or in any sport that requires an extended sprint distance. The 40-yard dash is the perfect test speed displacement from point A to point B. The equipments needed for this test are stopwatches, cones to mark start and stop point, and timing gates or stopwatches if required. The procedures for the 40-yard dash is that the athlete is required to stand in a sport-specific stance, whether in American football it's a 3-point stance, in track and field it's a 4-point stance, in baseball it's a lateral stance, and the athlete is required to run from point A, which is the starting line, to point B, the finish line, in as low as time as possible. The energy system used in this test is the ATP PCR, and the second procedure part of this test is that the stopwatch should be started, if you're using a stopwatch, should be started at the first movement of the athlete, or if the timing gate is used, the timing gate should start when the athlete moves and finish the pass. The final test is the 3-cone drill, or the L test. Each cone in the L test is placed 5 yards apart from each other. The purpose of this test is to test the agility, speed, change of direction, body control, and also agility and quickness of an athlete. The procedure of the 3-cone drill is that the athlete begins at a starting point, and at the first movement, the stopwatch is started. The athlete is then required to go to the first cone and back, then back to the second cone, to the third cone, loop around the third cone, and back to the starting point. This test is used in NFL Combine in replacement of the 4-cone drill or the box drill.